Is it going? Oh, okay. So every year since I was a kid, I've visited Hong Kong to see my extended family, and I've had the privilege to be able to do so because my mom works for American Airlines, so we can fly for free or for very low rates. When I go back to Hong Kong, I stay with my aunt and my grandpa. My aunt is a radiologist technician at Prince of Wales Hospital in Hong Kong, and I saw how much her work impacted her life and how much she loved her patients and her job, so I was dead set on being in the medical field. This year in ISM, I wanted to do cardiology, but I actually changed to radiology, and I wanted to do cardiology because I knew that cardiologists could make up to $500,000 a year, and that one day I could be cruising down the street in a Ferrari. But in ISM this year, I learned that it's not about the money, it's about loving what you do, doing it for the rest of your life, and having an impact on society while you do it. My name is Matt Lee, and this is my family. That's my mom, my dad, my brother, and my dog, and we love traveling. So ISM, what does it mean to me? I took ISM because I knew it would be challenging, and it was a way for me to really get out there, and it offered me an opportunity to build professional experience and prepare for my career even before college. So I thought that was a really beneficial way to start off my college career. So I think that this quote by Michael York fabulously describes what ISM is to me. He said, "I think you have to believe in your destiny, that you'll succeed. You'll meet a lot of rejection, and it's not always a straight path. There will be detours, so enjoy the view." ISM is independent study and mentorship, so there's going to be a lot of rejection, and you're not always going to get it the way you want. That's very evident in my case. So I just need to enjoy the view and build connections as much as possible, and so they can be beneficial to me in the future. So in my research, I'm very privileged to be in Frisco ISD, where we have a really great health science program. So with health science 2 combined with ISM, I've learned a lot about the inner workings of the medical field and the skills needed to be in the medical field. I've also learned a lot about the history of radiology and how to be a better radiologist through my ISM research. So my first research assessment was over the CAN-MEDS. It was an acronym for the core values that a radiologist has to have in order to be a good radiologist. So some of those included like being a health advocate and having integrity and honesty and just treating your patients well. This set the basis for all my interviews because I saw these core values in each of the people that I interviewed, and I really looked up to them. And I learned that these values don't only apply to radiologists, they also apply to other physicians. All physicians need to be good physicians because of we're in the service field, so you have to treat your patients well. My next research assessment was on telemedicine. So telemedicine is the use of technology to communicate and provide healthcare through Skype, email, phone calls. So I saw this used in children's health. In the hospital, they have the PACS system where radiologists can actually look at scans from different hospitals within the UT Southwestern system. So it has its pros and its cons, obviously. The pros are that you can, in an emergency situation, you can send a scan to a specialty professional. So let's say a kid cracks his skull, you can send it to a neuroradiologist, see if he sees anything that's wrong, someone with higher authority in that specialty. The cons, I saw this used in nursing, and I think that it's not a proper way to use telemedicine because for nursing, I believe you have to be there with the patient so you can see what's going on, what's going wrong, what they need, what they want. So I thought that wasn't used properly in nursing. Next, I learned about the errors made in radiology, especially the latent errors. Latent errors are made in communications and planning between radiologists and physicians. And I saw this as really unnecessary and as errors that really didn't need to be made. So this actually inspired my original work proposal. I also learned about the history of radiology through Marie Curie. So her research in radiology kind of inspired me. I looked into research, but I learned that there's a lot of obstacles for people in research, such as funding and the type of work and home balance that you have is not very good. But what was inspirational to me about radiology was I saw how much it grew over a couple of years. In less than a century, we learned what X-rays were and used it on the battlefield. So that was really inspirational to me. This was my favorite research assessment. It was a podcast about how X-rays work. So again, it talked about the history of the X-ray, how Röntgen discovered the X-ray through the cathode and anode. And it also explained how it works, which I actually didn't know until I listened to this podcast. So how an X-ray works is it's shooting the X-ray beam, and then it goes through your body, and it goes through all the soft tissue and hits the plate on the back, which records the beam. But your bones are dense enough to block the X-ray, so it's kind of like a stencil, which creates a negative of the image of your bones or any solid matter inside of you. The podcast also talked about the dangers of radiology and the levels of radiation. So you can only have up to so many X-rays per year as a recommended value, and a full body CT scan can actually be up to around 4 years of your recommended radiation. So I thought that was kind of scary. So there's a diagram of how it works. There's the stencil process, kind of, I guess. Next, in my interviews, I saw a love of the job of radiology in all the interviews that I had with people who worked at Children's Health. Children's Health is a teaching hospital where they have residents come in, so I thought that was probably why they love their job so much, because they get to be mentors, they get to be mentored, and they get to interact with a lot of people, and they're pretty much free in terms of time, much more than those in the private practice. I interviewed one person in a private group practice, and he didn't like it so much. So this is the doctor that I asked to be my mentor, Dr. Jerry Powell. He gave me some advice to not major in biology, because if you major in biology, you're kind of stuck with it if you don't get into medical school or a residency. He loved the patient interaction that he had in Children's Health, but he hated being on call because it took away from his family time. This is Dr. Ed Pong. He works with Texas Radiology Associates, which is a group private practice. He regretted doing the private practice because it sucked up a lot of his time. He didn't have many coworkers that were kind of in his bubble. He more worked by himself. He didn't have much time to do anything either because he had to manage so much. And he was an interventional radiologist. Interventional radiology is where a radiologist does small procedures under a fluoroscopy, which is kind of like an X-ray, but it's a video. So I thought that was really interesting. This is Dr. Kwan. She said that radiology, you should make it what you want it to be. So she's actually the residency admittance director at UT Southwestern. So she chooses who gets in and who doesn't. So I thought this was one of the most beneficial connections that I could have in my ISM career so far. So what she meant by making it what you want it to be, you can really excel yourself in radiology because you can choose what path you want to go down, you can specialize, and you can elevate yourself and make yourself stand out. She was the one that said teleradiology and telemedicine has its cons, and that's why I first heard from her. She didn't believe that radiology through telemedicine was very adequate because you can't position the patient how you want them to be. You can't fix any problems that are there while you're reading the scans. And there was a lot of work-home balance, she said, for radiology. So I heard that was good, and I look forward to having work-home balance as a radiologist. Dr. Veldkamp from Children's in Dallas. She majored in art history, which I thought was very strange, but then she said to major in something that you're interested in. It shows that you're really well-rounded, and you also need to volunteer to be accepted into residency. They need to see that you actually care, but you don't devote your whole life to one thing. And she used the term academic radiology. It was a new term to me, and I just learned that Children's Health was the teaching hospital through her. Dr. Corral, he said that you should know what you're getting into if you pursue radiology, because he's seen many people who thought they wanted to be radiologists but didn't end up being radiologists. He has previous mentorship experiences, so I thought that was really beneficial for him and his mentors. And he's actually a neuroradiologist, so he looks at the brain and the head and the nervous system through fluoroscopies. And he also does small procedures. Again, the interventional radiology, I thought that's really interesting. So next, for my original work, I'll just go over some of the steps it took. First, I had to research, so I pulled from my research assessments the research over communication and errors in communication was really what bugged me about the number of deaths in radiology. Up to 10% of the deaths in radiology can be from communication errors and planning errors and latent errors. So I thought that was a really high unnecessary death rate. It can also be from taking too long to determine what the patient has to the point where they just slip through the cracks before you can even find out what it was. So second, I brainstormed. I knew that to solve this error in communications, it wouldn't be a physical design, so I came up with a survey which can be used to improve the system between radiologists and the patients. And it has its flaws because of my inexperience in the hospital's policies. I actually designed my survey for Children's Health, but I don't think it can be applied anymore because I don't think I'm going to be in Children's Health. I created my original work by putting myself in the guardian of the patient's shoes. So I had to really think about what if it was me and my child was going into the ER, or what if I scheduled an appointment with the radiologist. So I formulated the questions based on improvement in specific areas that I wanted to know. And I predicted the average or the majority of the responses as an inexperienced kind of person developing the survey, because I wanted to compare what the actual was to what what I hypothesized it would be. So here's the first page of the survey. So first I gave them a little information about the survey, asked them what brought them to Children's Medical Center. So they can either be there for an ER visit or a scheduled appointment. And if they chose the ER visit, I wanted to know how long it normally takes for them to find out what is wrong in the emergency room. So it really depends on the case, but I wanted to find the average. And if they were there for a scheduled appointment, I wanted to know if the hospital was good at letting them know in advance if they had to have any dietary limitations because of the procedures. For example, a swallow study, they might need to fast so they can see the dye or the food going down the esophagus and through the stomach and the GI tract. Also, I wanted to know how they contacted their radiologist, either through the ER visit. Children's Health will assign them a radiologist, or if the pediatrician assigned them a radiologist or recommended a radiologist. So then I asked them also how they preferred to contact their radiologist, because I think the communication is very important. So based on that question, the radiologist could know the trends and see how patients and their guardians like to be contacted. And I also wanted to know if the radiologists were being referred to them, or if they just randomly chose the radiologist, or if they had been with the radiologist before. That was mostly for cancer patients. And then I also wanted to know it's really important that the medical vocabulary that you use to explain to a patient what their condition is really clear, because all these medical students, residencies, they make you think that everyone knows what you're talking about, when in reality they might not know what leukemia or some other long words that they might not know are. And then I also wanted to know how they were made aware of the condition or illness, who told them what the condition or illness is, because I believe that the radiologist should be the one to talk to the patients and let them know what's going on. So to follow up with that question, I asked who would they prefer to be notified, who would they prefer to notify them about their child's condition. And if they're aware of the condition, was a visual aid used? Because I believe the visual aid, at least a scan or a picture or an example of the illness should be used to help further explain what's going on and what the patient and the family can do to help better the situation. And then I wanted to know an overall rating of the explanation on a scale of 1 to 10. So next, I predicted the responses. So the first page, it really depends on the case. So ER visit or scheduled appointment, you never know. Number 2, depends on the situation as well. I think that most people, however, would prefer to have their pediatrician contact the radiologist, and I feel like in the ER, the assignment by Children's Medical Center is usually what happens. And then in terms of vocabulary, there's always room for improvement, so I feel like the patients would choose around a 6 on a scale of 1 to 10. I don't doubt that Children's Medical Center does a great job in treating their patients, but it can still be pretty hard to explain medical vocabulary. Number 6, I think that the nurses tell the patients at Children's. I'm not sure of their policies, but I think that was what happened when I went to Children's Medical Center of Plano. I think that the patients also would like the radiologist to tell them, because it's really important that you have the most professional person explain to you, especially in the circumstances that you're in. And I think that they want to have a visual aid to be able to explain to them. Visual aid is really important to show what's going on, the condition, and how they can better it. So the impact and application of my survey, I made it so it could easily be tweaked, and it can be changed from hospital to hospital. If your policies are different, then you can change the survey really easily. I wanted to give the survey to radiologists so that they could learn the trends that are going on, and I could graph the data for them to show the trends that are going on as well. And the good thing about the survey is that once you perfect it for your hospital's needs, then you can keep using it for continuous improvement to kind of change the system as you go to see what's best for the patients. So mentorship, I don't have a mentor yet. I asked Dr. Powell at Children's Medical Center, but I don't think that's going to work out. So I thoroughly enjoyed my interviews, however, with everyone. And I decided that I want to pursue pediatric radiology, maybe in children's health, and I was hopeful for a mentor at Children's Health. Future plans, hopefully after senior year, I'll be in a pre-med program or majoring in something interesting like Dr. Veltkamp said at UT Austin, U Chicago, or Northwestern. And after college, I want to go to medical school and then get a residency for radiology, which is actually a really hard thing to do. At our UNT field trip, the biology professor told us that he knew a student that was the valedictorian of his class, but he still didn't get a residency in radiology. And I hope to specialize in pediatrics as well. Thank you.